This is task number 50, how to perform a dental prophy on a dog. First I have all my supplies gathered here that I'll be using during this dental. I have gloves, a face mask, and some goggles. Personal protective equipment is important during a dental because you can have aerosolized particles and bacteria from working in the mouth, and so you want to make sure that you have your personal protective equipment on at all times during a dental. I have some gauze to help pack the back of the throat so that water does not go back there and the patient has a risk of aspiration. It's also important to have them intubated during these procedures so that you know so that they have less of a chance of aspirating any fluid that goes back there. Dental prophy paste I will use to polish with a tongue depressor to just apply it with, and then a cup of paste, prophy paste cup that will use to be applied and polish the teeth after the dental is complete. Some calculus removal forceps, a periodontal probe, and then curette, 2 different types of totally blanking on the word, curette and scaler, or dental scalers, and then I also have the tip for my ultrasonic scaler that I'll use to do most of the cleaning with. We also have here behind me, this is our dental cart with the ultrasonic cleaner, and then some air and water ready to go. There's also drills, and this is the polisher when I'm ready to go. So the first thing that I'm going to do when I have our patient under anesthesia is I'm going to do a general overall exam of the head. I'm going to just feel around the front to check for any swelling in the top of the mouth or on the bottom or lower jaw, and then I'm going to feel for the sublingual lymph nodes and the salivary glands back there. Then I'm just going to look at her inside of her mouth, look for any masses, soft tissue swellings in the mouth. I'm going to look under the tongue, both sides, the back of the mouth, look at the tonsils if they're enlarged. And then I'm going to, once I look at all of those, I'm going to look at the teeth and look for, if this dog was young, we would want to look for any retained deciduous teeth or any obvious fractures of the teeth before I started my exam. And then we're going to, I'm just going to write down on our dental chart here what a general overall of what I see. So I'm going to mark down which teeth have the heaviest calculus. If there are any missing teeth, I would circle them. And if there are any like fractures or pulp exposed, I would mark those too. So just starting from the incisors, they look pretty good. There's not a lot of tartar on them. The canine has just a slight bit of tartar on it. So this is the right side up, so I'm just going to mark that this upper has slight tartar on it. And then moving back, the 4th premolar has quite a bit of tartar on it, so I'll just mark that that has medium. And then the back teeth are do not have a lot of tartar on them. She has a little bit of gingival swelling, just redness right above it, the start of some gingivitis there, and also above her canine as well. Okay. So to begin with, I'm going to use my calculus removal forceps. I'm going to place this straight edge behind the tooth and then just gently kind of crack the calculus off without applying too much pressure to the teeth. It just gets off large amounts of tartar to the area. So I just place it behind and then just kind of gently crack it off. And then also do that on this tooth at the front of the canine. Okay, so I'm going to use an ultrasonic scaler next to get the rest of the calculus off. First, what I'm going to do is I'm going to place some gauze sponges in the back of the mouth. Place 2 in there so that it minimizes the amount of water that goes to the back of the throat, because we don't want them to aspirate any fluid. You always want to make sure that you're replacing these also frequently because they do gather water. So you want to make sure that you also remove them after the dental is done, as well as replace them frequently. Also want to support their head and neck with a towel underneath it so that the water drains away from the back of their throat. So next I'll use the ultrasonic scaler. I want to use not the tip of it, but the edge of it to clean all the teeth, and you want to start from the top of the tooth and then work my way down. And usually I start on the work my way from the front to the back. When you're using an ultrasonic scaler, you don't want to leave it on the tooth for more than a few seconds because it can cause heat damage to the tooth. finished ultrasonic scaling, I'm going to use my curette to just curette underneath the gum line to get any calculus that's built up under there. So I'll start at the front. And just gently go up underneath there, go down towards the tip of the tooth. Making sure that I'm getting anything that's up underneath there. Okay, now I'm just working on the back side, curating underneath it. Moving away from the tooth, or I'm sorry, moving away from the root of the surface. The root, moving away from the root as I work. Okay. So now that I'm finished curating or scraping the tartar away from under the gum line subjugally, I'm going to use my periodontal probe and start it in the same manner, going front to back, and then on the way back I will probe on the inside of the mouth as well to check for pockets. And just make sure that I'm getting the back side of the tooth. And then I will work my way back on the inside. No pockets there. Covered all the surface of the teeth. And then at this point, if I had found any pockets or if there were any fractures or anything that the doctor wanted to look at, I would take radiographs before putting any polish on the teeth, because the polish is radio dense, and so you can see it on radiographs, and that would obstruct the possible diagnostic quality of the radiographs. So first what I'm going to do before I do that is I'm going to replace her get some new fresh gauze in there. Being careful not to move the tube in her trachea. And then I'm going to rinse the teeth, some water. Spraying out, away from her back of her throat so that it drains away from it. And we use the polisher. I have my dental prophy paste here on this tongue depressor, and the dental prophy, the paste cup on the rotary thing, and then I'm going to just apply a generous amount to the cup, and then I will put firm pressure on there so that the cup flattens out, but you don't want to hold it on the tooth for very long because it can cause heat damage to the tooth. You want to make sure that you're getting up underneath the gum line as well, so it bells out. And then working my way back on the inside. Okay, last thing that we're going to do is rinse again. Rinsing from the back to the front, making sure to get all of the prophy paste out. And allowing it to drain so that it doesn't gather at the back of the throat. Okay, so her teeth look nice and clean now, and we'll move on to the other parts of this dental. Okay, now that we're done with our dental, I'm just going to make sure that this patient is presentable for a return to the owner before we wake her up. So I'm just going to carefully dry around her mouth to make sure that her hair doesn't look too messed up. If there's any blood on the animal, you would want to use some peroxide or something to get the blood off of their fur, especially white dogs, because it shows up really well on white dogs. And then also if there's any, like if their ears got wet or anything, you just want to make sure that they're relatively dry and combed out so that they look like they were when they came in. Before returning them to the owner. So now that I'm all ready for my procedure, I'm going to demonstrate how I would do a dental procedure on a skull. Our skull here does not have very many upper teeth in its upper quadrant, or in the maxilla. So I'm going to demonstrate using the teeth in the lower quadrant of the mandible. So patients should be anesthetized for any dental procedure. It's important to have them intubated at all times because it can prevent a properly inflated endotracheal tube will prevent aspiration of fluids. Also, having mouth gauze placed in the back of the throat can help prevent aspiration of fluid as well. So to begin with, what I would do is I would do an overall exam of the skull first. I would palpate the maxilla and the nose and check for any swelling around the base or the around the mandible or the maxilla. Then I would just palpate the neck region, look for the salivary glands and the submandibular lymph nodes. Then I would do an oral exam of the mouth, check under the tongue, check all the soft tissues for any soft tissue swelling, check the tonsils to look for enlargement of the tonsils, and then examine the teeth. Look for any recession of the gum line. You want to look for heavy calculus or fractures, wearing of the teeth, and want to chart those. This is like an example of our chart here that we have the upper and the lower, and you can put all the numbers here. So we would just mark down what that like what numbers I can work down the calculus level, the gingivitis, if there's any gingivitis, or if there's any fractures or missing teeth on this dental chart. So now that I've done my overall exam, I'm going to start with any heavy calculus by using my calculus removal forceps. I'm going to use the long straight portion of the instrument to along the back of the tooth and the curved part against the front of the tooth. So just gently, because this patient has some mobility in its teeth, I'm just going to gently apply pressure and kind of crack off any heavy calculus. Usually I would start at the front actually and just gently crack off any hard tartar or calculus present. Makes it a little bit easier to use the scaling equipment afterwards. So we have different angles of hand scalers that help based on the angle of the tooth that you are trying to scale. So in order to hand scale, I would just start at the bottom of the tooth and just pull away, making sure that I am getting every aspect of the tooth. This is just for supragingival scaling, not for subgingival scaling. And then on the way back, I will just go around the back side of the teeth, making sure that I get every aspect of the tooth. Then if we could also do just ultrasonic scaling. So we have our ultrasonic scaler here, and in general you don't want to use the tip of the ultrasonic probe to do any portion of the dental. You want to use the side of it, just starting at the bottom of the tooth and then moving up in the same manner that you would the scaler. It's important to not leave the ultrasonic probe on the tooth for any amount of time, or for longer than like 10 to 15 seconds, but like in any place longer than 2 to 3 seconds, because it can cause heat damage to the tooth and damage the internal aspects of the tooth. Now that completed ultrasonic scaling, the next thing that I would do would be to grab my curette and do any subgingival scaling or curetting with the curette. So I'm just going to use the edge of it to go up underneath the gingival line and then scrape away from the tooth, making sure that I'm getting up underneath the gum line and around each edge of the tooth. And you can use the back end of it to do the back side of the teeth, making sure that you get all angles. So once I was done curetting, I would rinse the mouth from the outside or the inside of the mouth to the outside of the mouth, because you want to point to the water towards the outside so that it drains away and away from the back of the mouth so that they don't gather a lot of water in the back. You can also tip their heads forward or prop their necks up with a towel so that they are pointed down and their water drains out. So just rinse it, make sure it's nice and all the grit and debris is out. And then we will do a probe with the periodontal probe to check for depth or pockets around each tooth. And these periodontal probes are graduated, so you have different lines at the appropriate millimeter mark. So you just want to go underneath the gum line and check for any pockets around each tooth on every aspect of it and every surface to make sure that you're not missing any pockets. And then at this point I would usually replace the gauze in the back of the throat because it's probably completely filled with water by now, so you want to make sure you replace it so that it doesn't get over soggy and start dripping water down the back of the throat. After the periodontal probe, and if there are any pockets or anything that were found with the probing or during the dental, or if there are any fractured teeth that we want to take radiographs on, this would be the time to do it. If there are really suspicious teeth that you don't want to, that might be extracted, you would want to take radiographs before cleaning it, because you're not necessarily going to clean that tooth if it's being extracted. So take radiographs before applying prophy paste, because the prophy paste is radiopaque, and it'll show up on radiographs and can obscure the diagnostic quality of the radiograph. So with our prophy paste, what I would do in the same manner that I did, I would apply firm pressure so that it bells out at the bottom, and it can go underneath the gingiva to get all of the little scratches that I did while doing the dental, because the ultrasonic cleaner and the curetting, it can cause little imperfections in the tooth, and so you polish them out with this. So you just want to apply firm pressure, make it bell out underneath the gum line, and you don't want to leave it on the tooth for more than a few seconds in one spot, because this can also cause heat damage as well. I always want to get the back of the tooth on your way back, making sure that all surfaces of the teeth are covered and polished out. Then I would do a final rinse, again doing the same manner, moving out, getting all of the prophy paste off the teeth and away from the back of the mouth. Then I would remove my gauze from the patient's mouth so that I knew that it was out and they're not, before we extubate the patient. Make sure that there's no, just, rinse out the water and any other debris from the mouth really well. And then also before, while the patient's still sleeping, it's easier to make sure that they're all clean so that they look presentable to the owner. So when we're doing dentals on patients, it's important to understand the different types of teeth that each patient has. Both cats and dogs have 4 different types of teeth. They have incisors here at the front. They have a single canine on both tops and bottoms in each quadrant. And then premolars and molars. The dental formulas that they each have vary a little bit, but they have the same general type of 4 different types of teeth. So they're dental formulas for dogs and cats. These are both dental formulas for adults. Dogs have 42 teeth. This shows that on the upper jaw they have 3, and in the lower jaw they have 3 incisors. Big I for mature incisors. 1 canine on both the upper and lower jaw. Big C for canine. 4 premolars, P for premolars, and then 2 molars on the upper mandibular quadrant, and then 3 molars in the lower. The 2 in the maxillary, and then the 3 in the mandibular quadrants, equaling 42. And cats, it's the same general idea. They have 3 incisors, 1 canine, 3 premolars in the maxillary, 2 in the mandibular mandible, and then 1 molar in both the maxilla and mandible, equaling 30. Another important thing to recognize to help you know your way around when doing dental is the different surfaces of the teeth, because it can help you chart effectively and to know where if you have pockets, you can test for them around each surface of the tooth and then chart them appropriately. So for the mandible, the inside of the tooth is the lingual surface because it faces the tongue. The inside of the maxilla is the palatal surface because it faces the palate. As you're going towards the nose, the front surfaces of the tooth are called the mesial surfaces, and as you move to the back of the mouth, the back side of the tooth is called the distal. Then towards the outside, towards the cheek, is called the buccal, and then towards the front of the mouth is called the labial. Both of them can also be called the vestibule because you're going towards the outside of the mouth. So these are 2 dental instruments that I would use during a dental prophy. This one is a hand scaler instrument that is used to scale any debris or calculus or tartar off the supragingival surfaces of the tooth, so above the gingiva. And this is a curette, and it is used to remove calculus and debris from underneath the surface of the gingiva, so subgingivally. And with both of these instruments, it's important to know which edge is the cutting edge because that will impact the way you handle the instrument. Each end has a different direction, so if one side is not the correct cutting edge, you can flip it over and get the correct cutting edge that way, so that you're applying it to the portion of the tooth that you are trying to clean. So when taking radiographs on a patient, radiographs are really important because they show the bottom, the portion of the tooth that you cannot see with your with your eye. So it shows you what the root is doing, and the jaw and the bone around the root of the tooth. It looks for reabsorption, abscessation of the tooth, or bone loss as well. And all these things you cannot see from the exterior portion of the tooth. You need to be able to see them with a radiograph. So this helps us by if you have a fracture or any suspicious tooth that might need extraction, you can take a radiograph and determine if that tooth is going to be a problem. So moving on to different diseases that we look for when doing dentals. First thing that we look for is calculus, which is a buildup of calcium deposits and debris and bacteria on the tooth surface. This can lead to gingivitis, and ultimately it can lead to periodontal disease. So it's important to do routine maintenance on the teeth, whether it be dentals or routine brushing, to remove calculus so that it cannot build up on the teeth and cause further damage. So periodontal disease is one of the main diseases of canine and feline mouth that we look at. It starts with just stage 1 gingivitis, when plaque accumulates on the tooth and then gets up underneath the gum line and causes inflammation in the gingiva. Then as it progresses, the gum line begins to recede and become more swollen, and then you can begin to see the furcation of the tooth roots with stage 2 periodontitis, and it usually results in that tissue loss can then expose the tooth root. Then as it progresses to moderate periodontitis, you get further loss of the tissue to the bones, and you see more of the furcation. This is when you start to get tooth root or mobility and begin to be in a stage of irreversible periodontitis that cannot be repaired with routine cleaning. And then there's advanced periodontitis, which is over 50% of losment of the tissue attachment to the bone. You start to get, back here in stage 3, you start to get bone loss around the root surface as well, and loss of the attachment of the periodontal ligament. And then here you'll start to get tooth loss and severe bone loss in the jaw. Okay, so other things that we look for besides periodontitis or periodontal disease is tooth fractures and tooth wear from chewing on things. So fractures can happen whether they're a slab fracture from trauma, or from chewing on something really hard like rocks or really hard antlers or bones. They can get slab fractures or complete fractures of the teeth, and usually sometimes they occur with or lead to pulp exposure, which can lead to abscessation of the tooth. So it's really important to look at fractured teeth to find and take radiographs of them to see if there is any resulting abscessation below the gum line, or if there's pulp exposure on the fracture. Wearing of teeth is usually due to chewing on anything hard as well. They can chew on like metal grates or something if they're in a kennel situation, or they can be chewing on rocks and just wearing their teeth down until eventually they get tooth or pulp exposure. So it's important to not allow pets to chew on anything that might cause damage to their teeth. Retained deciduous teeth is another thing that we look for in young animals. retained deciduous teeth are baby teeth or juvenile teeth that have not been pushed out by the adult tooth as it is erupting. So it can cause, that retained deciduous tooth can cause malocclusion of the adult teeth and cause different issues like plaque buildup in between the teeth as the animal ages. So it's important to remove them as you find them. Or you can use orthodontics to correct the issue as well. Abscess of teeth usually is due to an infection, whether it be resulting from a fracture or trauma, where bacteria got into the pulp and then resulted in an abscess below the gum line. You can find these on radiograph. Sometimes if the is progressed far enough along, the abscess can erupt, and sometimes you'll find them below the eye as swelling and then a draining tract. And they can be very, very painful for the pet, so they might stop eating or not want to eat, be reluctant to chew or open their mouth because it's painful for them. So we want to take radiographs and find any abscess tooths that way. One of the last things that we look for that can also be caused by a tooth root abscess is oronasal fistula, which is an opening, but usually in the palate of the mouth, or in the palate of the roof of the mouth, into the nasal cavity. And that usually occurs around the canines, but it can happen anywhere that an abscess tooth can occur. So the only way to correct an oronasal fistula is to remove the abscess tooth, as well as layering a flap of skin over the opening to close it so that the fistula is closed. So in order to get ready my take-home instructions for the dental that I performed today, I'm going to use my dental chart that I wrote down on and put it into our computer. Our computer program has a similar diagram in it. Here I can put all of the indications that I put on my sheet when I was charting the patient's mouth in here to let the owner know what we did in the mouth. We can mark any teeth that we extracted, and here in these boxes we can write the periodontal numbers that we used with the probe, upper and lower jaw. And then there's this key here for the owner that has our general just notations for what that is, so mobility or extracted or missing discolored teeth. Then we have gingivitis, periodontal index, calculus, and mobility. You can write down there, and then here at the bottom, oh boy.
There you go.
Here, okay, ready again. So we also have here what we did during this procedure, and if there are any special procedures that we did, if we took radiographs, if we did surgery, or if there are any teeth that we recommend monitoring post-operatively or post-prophy for the owner to watch. And then we can do before and after photos so that the owner can see what we did while the patient was under anesthesia. So together with this, we would send this home with the patient as a general overall for what we did. And then we also have take-home instructions for dental aftercare that we'll print out when the patient checks out. So this will show any signs to watch for after anesthesia, as well as what to look for if they have questions about the teeth. So we sent home a variety of things with all of our dentals that help the owners continue or encourage the owners to continue up with their pet care. We start the with brushing. Mechanical brushing is the most effective way of removing calculus from the tooth or preventing the buildup of it. You want to use in larger dogs, you can use a soft bristle toothbrush. You want to make sure it's soft and not firm or hard, because the hard bristles can irritate the gums and cause recession. So a soft bristle toothbrush, and then just circular motions working from kind of the bottom or the root of the tooth down, not causing too much inflammation or not causing too much irritation to the gum line. And then in cats or small dogs, you can use this like little finger brush that we have, and that helps just on small dogs. Because it can be difficult to brush pets' teeth, it's important to acclimate them to it slowly. Just applying a little bit of, we have enzymatic toothpaste that tastes, they might like the taste of, that you can put on your finger and just let them lick it, and so they get used to the taste of the toothbrush, or the taste of the toothpaste, and then slowly work your way into using a toothbrush with a little bit of the toothpaste so that they enjoy the experience. It's also good to do it during the same time of day so they get a treat afterwards, so that they know it's a good thing. Also sent home that we have this little how to brush pamphlet that we sent home, so that's good for the owners to look at as well. Then there are several different diets that can be used to help with cleaning of the teeth. One that we carry here is TD, so the Hill's TD diet, or you can get little enzymatic chews for cats. And the way these chews work, or diets work, is that they use very large kibbles to so that the pet has to chew them in order to eat them, and they have enzymes in them that help break down the calculus, as well as the action of the chewing of the large kibble to prevent the buildup of calculus. Other things that can help with maintenance of teeth is chews and toys. You don't want to give them anything that's too hard, because that can cause fractures or wearing of the teeth. So no antlers or really hard bones. You want to discourage chewing or eating rocks, or any pull chew toy, because they can cause damage to the teeth. Chews that would be acceptable are any of the nylabone type chews, or rubber chews that have the different textures on them that help massage the gums and help remove plaque and tartar from the teeth. And that is how you perform a dental prophy on a dog.